Hi guys, welcome to my channel. This is Arvin Baay, and today's video I am going to talk about Philippine Patient Bill of Rights. And if this is your first time in my channel, please don't forget to like, share, and subscribe, and hit the notification bell for more updates. So, what is Philippine Patient's Bill of Rights? Right to appropriate medical care and humane treatment. The patient has the right to appropriate health and physical care of good quality. In the course of such, his human dignity, conviction, integrity, individual needs, and cultural shall be respected. There are 13 types of rights. First one, the right to appropriate medical care and humane treatment. Every person has the right to health and medical care corresponding to his state of health, without any discrimination and without the limits of the resources, manpower, and competence available for health and medical care at the relevant time. Second is the right to informed consent. It's a process of communication between you and your healthcare provider that often leads to agreement or permission for care, treatment, or service. The third one, the right to privacy and confidentiality. Privacy refers to the right of an individual to keep his or her health information private. Confidentiality refers to the duty of anyone entrusted with health information to keep that information private. Fourth one, the right to information is an act of the Parliament of India which sets out the rules and procedure regarding citizens' right to information. It replaced the former freedom of information. The fifth one, the right to choose healthcare provider. The patient is free to choose the healthcare provider to serve him as well as the facility except when he is under the care of a service facility or when public health and safety so demand or when he, the patient, expressly waives this right in writing. Next, right to self-determination is the right of the people to determine its own destiny. In particular, the principle allows the people to choose its own political status and determine its own form of economic, cultural, and social development. 7. The right to religious belief. Everyone has the right to freedom of thought, conscience, and religion. This right includes freedom to change his religion or beliefs, and freedom, either alone or in community with others and in public or private, to manifest his religion or belief in worship, teaching, practice, and observance. Next, the right to medical records. The patient is entitled to a summary of his medical history and condition. He has the right to view the contents of his medical records, except psychiatric notes and other incriminatory information obtained about third parties, with the attending physician explain contents thereof. 9th, the right to leave. The patient has the right to leave hospital or any other healthcare institution regardless of his physical condition provided. Number 10, the right to refuse to participate in medical research. This should not affect their care, enrollment, and a clinical trial also not prevent a patient from obtaining timely and appropriate medical care. Number 11. The right to correspondence and receive visitors. The patient has the right to communicate with relatives and other persons, to receive visitors subject to reasonable limits prescribed by the rules and regulation of the healthcare institution. Number 12. The right to express grievance. The patient has the right to express compliance and grievance about the care and service received without fear of discrimination or reprisal and to know about the disposition of such compliance. The last but not the least, the right to inform of his rights and responsibilities as patient. In the course of the patient's treatment and hospital care, the patient, his or her legal guardian, has the right to be informed in the result of the evaluation of the nature and extent of his or her disease